Great question. So people with multiple health conditions, some of them significant, some of them may not be quite as significant, but any questions you should check in with your primary care provider. We're keeping the primary care physicians in the community up to date on who should be vaccinated. So check in with them. They'll help be able to better assess your health conditions, past medical history, and be able to determine what phase you fall in. So great question, Courtney. You know, there's limited data on the vaccine for women that are pregnant or breastfeeding. At the end of the day, the CDC is recommending that people who are pregnant have a conversation with their healthcare provider. And here's what you have to weigh. You have to really weigh the pros and the cons. If you're someone that's regularly engaging with COVID-19 patients, I'm kind of thinking about some of my healthcare colleagues who are pregnant, then you may want to get the vaccine for sure, right? Because the benefits of the vaccine in that situation may outweigh the risks. If you're not really coming into contact with individuals who have COVID and largely staying at home and away from people, you may decide not to get the vaccine if you're pregnant until there's more data available. So it really comes down to that personal discussion. I encourage you, of course, to talk with your primary care provider, your OB doc, et cetera. So it's really a personal decision. But I do want to acknowledge that there is limited data available in pregnant women and those who are breastfeeding. So mental illnesses are obviously a huge problem, a big problem during the pandemic. They didn't look specifically at how the vaccine may affect people with mental illness. I would want to say, thinking about the biology and the science behind it, there's no reason to think that the vaccine would adversely affect people with mental illness. So that's not a contraindication, meaning people with mental illness should definitely be vaccinated, in my opinion. Certainly people have other diseases other than mental illness. And certainly, you know, one thing that's come up, for example, is people that have severe allergies, right? Anaphylaxis. So people with anaphylaxis, really significant allergies, should talk to their primary care providers about getting the vaccine. The state will not be actually administering the vaccine, so we're going to be relying on clinics and existing healthcare structure to actually vaccinate, whether it be through the hospitals or other clinics or other providers in the community. So if people have questions about if they are eligible for the vaccine, I do encourage them to check in again with their physician or another medical provider to see if they qualify in terms of having one of these higher risk conditions. And unfortunately, there's no easy answers here. Of course, as a father, you know, kids 9 and 13, teachers in schools are always on my mind, but we had them a little bit lower because they're just at a little bit less risk of getting sick. That being said, certainly teachers and staff at schools and otherwhere that have a higher risk comorbid disease, like absolutely, they qualify for a vaccine early on. So we've tried to thread that needle between really doing our best to balance who got it first in terms of minimizing hospitalizations and deaths and et cetera.